Yeah. All right. Looks like we're all good to go. So, well, thank you all for being here today. This is our summer meeting for all of our vendors for La Crosse County Human Services. I am Paul Mettinger. I'm the contract unit supervisor. Stepped into this role when Chris Sander retired in April. So it's nice that you could all be here today. And the first thing we're going to do is just kind of go around and do some introductions. If you could just let us know kind of who you have here today, and if you have any quick updates for your organization, you can feel free to share those as well. And then after introductions, we'll go into some of the contract information and then program specific information as well. Um, oh, so people trickling in. So we can go ahead and get started with the introductions. Again, I'm Paul Mettinger, Contract Unit Supervisor here at Cross County Human Services. And before we dive into our vendors we have here today, if we have any La Crosse County staff with us today, if they would go ahead and introduce themselves. I can't, got a big list here today, so maybe we could start with the contract unit. Cindy,
I'm,
oh,
yep,
go ahead.
I'm Cindy Werschke. I am the contract unit clerk. I'm the one that sends you your contracts to sign and asks you to send that back to me and keep track of any compliance documents that are involved with your contract.
Hello, I am Tiffany Cornell and I am the contract unit specialist. So I kind of do all the back end stuff to get things ready for Cindy to process the contracts.
Any other La Crosse County staff with us here today? Go ahead.
Yeah,
Feel free to chime in.
okay. I can go next. I'm Shelly Tollefson. I'm one of the Children's Long-Term Support Waiver Supervisors.
Hi, I'm Christy Harrell. I'm the Quality Assurance Supervisor. I am Heather Lind, a CCS Supervisor.
Ryan Ross, one of the other CCS supervisors.
And I'm Cassie Schaefer. I am the CCS CLTS program specialist.
Is that it for our internal staff here today? Well, thank you all for being here as well. So, and if we do, and then we can go through our list of vendors that we have here with us today. And if I miss anyone at the end, feel free to chime in. And I've got a big list here, but every time we do this meeting, it seems like there's someone gets missed. So feel free to chime in at the end.
Paul.
Yes.
Sorry, Ellen didn't get a chance to introduce herself.
Oh, Ellen, right.
Apologize, I had to step out for a minute. So yes, hello, I'm Ellen Daubert. I'm one of the supervisors with CCS and CLTS here at La Crosse County and for Rick.
That's Ellen. Okay. All right. So again, thank you all for being here today. And if I miss anyone, feel free to chime in at the end. We'll just kind of go in order here. We have Answering Innovations. Okay. Acadia Healthcare. But Adams and Associates.
Have to get the microphone on. Hi, I'm Sue Johnson, and hopefully you can hear me. The technology's working today. and we're pretty much status quo, still doing annual reviews of protective placements, and but everything's pretty much status quo.
Thank you. AJ Falkers?
I am Amanda Falkers, the owner of AJ Falkers Counseling and Consulting Services. No real major updates, just that we're continuing to expand. So we still have our 4 offices in Galesville, La Crosse. We just moved our Toma office to expand that to offer more services to the Toma area. And then we still have our Sparta location.
Thank you. Almost Family? How about Attic? Anyone with Attic here today?
Hi, I'm Carla Campion. I'm the supervisor with Attic. No new updates. We continue to provide the outreach services and also CCS services.
Thank you. Brave Spaces.
Hey, I'm Nicole Millerin, co-owner and clinical therapist with Brave Spaces, La Crosse, and Sparta. We are going to start onboarding a art skills person. So she won't be a therapist, but I'm excited to bring something more. She's a retired art teacher, so lots and lots of years. So we're pretty excited to have her. And then the other co-owner, Nancy Pullman, just got certified in phase 2 of NMT, Neurosequential Model of Therapeutics. So I know a lot of people are have clients that have had those assessments done. So Nancy is now in phase 2 certified for that. So thanks.
Thank you. Roblox? Catholic Charities? Chalita?
I'm Melissa Vanosky, the Director of Shine Community Services. I don't have any updates to share right now.
Thank you. Christian Servants Home Care?
Hi, I'm Lauren Matera. I am General Manager for Christian Servants Home Care. We don't have any updates either, just continuing to grow and serve our CLTS and CCS communities in La Crosse and surrounding counties.
Thank you. Corporate Guardians?
Hi, everyone. I'm Zach Gabert. I'm the program manager at Corporate Guardians. As far as updates, we are maybe for the first time in a while fully staffed and actually overstaffed intentionally, just so that we can continue to accept new referrals throughout the state. We're licensed for up to 800. We have 9 office locations throughout the state, a staff of 25. So with pretty much full state coverage. So yeah, I think that's all I got for updates. So good to see everybody.
Thank you. Family and Children's Center.
Good morning, Barry Jacobson, Wisconsin Director of Programs with Family and Children's Center. And we really have no updates at this time. Thank you.
Thank you. Blocks Guardians.
Hi, we have Renee and Kim here on the one for Renee, and I think Rochelle's on as well.
Flying Horse.
Hi, I'm Lisa at Flying Horse. Sorry. I do equine assisted and trauma informed learning and provide CCS services, and no updates right now. Thank you.
Hope Restores.
Hi, I'm Tashira Jackson, Executive Director with Hope Restores. We have no new reports right now.
Independent Living Resources.
Good morning. I'm Sarah Eklund. I'm the director with Independent Living Resources. We're located in La Crosse, but we serve 13 counties in Southwest Wisconsin. And also our supervisors, Ellen Young and Sadie Nelson, are also on the call.
Thank you. Innovative.
I'm Vanessa Hudson, the CCS Administrator for Innovative Care Services.
Jackie Nitschke Center.
Hi, I'm Haley. I am the Director of Operations at the Jackie Nitschke Center. This is my first one of these meetings, so I just kind of wanted to, get more information and see what this is all about.
Thank you. L&P Services.
I think I saw they had a chat acknowledging they were here, Paul.
Yeah, I see we had looks like Lisa with L&P, so. Gotcha. Thanks, Ryan. We have Lakeview and Hillview as well.
Hi, I'm Rochelle Lee. I am the Assisted Living Supervisor out at the Lakeview campus. And we currently have 2 residential facilities that we provide housing for 7 of the CCS consumers. And joining me is Nicole Weigel, Molly Hagen, and Lisa Gibney. Ladies, anyone have anything to chime in on? I guess we're good. Everything's good here.
Thank you. Lutheran Social Services.
Hi, everybody. I'm Stephanie Pritchard. I'm Regional Director for Lutheran Social Services. Currently in La Crosse, we provide adoptions and foster care services, as well as some tax credit or affordable housing services that I believe are new in the last year or so. So, yeah. That's all I got.
Thank you.
No problem.
Mastering Life Skills.
Good morning, Stacy Masters, Mastering Life Skills, mainly providing CCS and CLTS services.
Thank you. Milkweed Connections. Nova Counseling. Parenting Peer.
Hi, I'm Bailey McGowan, Parenting Peer. We provide certified parent peer support.
Thank you. Peace of Mind Counseling.
Hi, I am Jay Clark, and we really don't have any new updates, just plugging along in the 3 counties with counseling services.
Thank you. Rocky Hill.
Hi, I'm Michelle Utes, owner director of Rocky Hill Parent and Peer Specialists. We have parent and also peer specialists. Some people are dual certified. Right now we've got provider available in Jackson County and one available in Jackson and Monroe counties. Thank you.
You. Soaring Skills.
Hi, this is Mike Elliott with Soaring Skills, and our only update is our Sparta groups are off to a great start.
Thank you. Stein Counseling.
Hi, my name is Tiffany. I'm here at Stein Counseling. We provide multiple different services, whether that be outpatient, in-home counseling, dance movement therapy. We also bring therapeutic services directly into some of the schools in our local school districts. We offer ART, which is the accelerated resolution therapy, and almost all of our providers are trained in that. We are also a DHS 75 clinic, meaning that we can provide substance use prevention, intervention, and treatment. We provide ISDE, wellness management, peer support, circle security, supervised visitations, just to name a few. We have a couple different groups that are available too. We have the Adolescent DBT Skills Group, which is for high school students struggling with emotional dysregulation, self-harm, relationship difficulties. We have our Safe Spaces group, which is on Mondays for high school students and middle school students who identify as LGBTQIA+ or questioning. This group addresses social and emotional and identity related challenges. We also have a new group called Healing Hearts, which is an interpersonal violence support group. They meet on Tuesdays for victims and survivors of interpersonal violence, and they provide a safe space to process and recover from that too. Another new group that we have is the Connection Corner, which is a social skills group that's offered for children ages 6 to 18. And this is concurrently on Mondays and Thursdays throughout the summer to help kids build confidence and connections and peer interactions. And then we also have a massage therapist who is new to us. This isn't covered by CCS, but it can be billed through CLTS. So yeah, we've got a lot going on here at Stein.
Looks like it. Thank you. Success for Life.
Hello, I am Christopher Bryant, one of the program administrators with Success for Life. You're probably used to seeing my colleague, Catherine Anderson or Katie, join these meetings, but I get to join today and she'll be on a little bit later. Success for Life is able to provide individual skill development, employment-related skills training, and wellness management and recovery services for both youth and adults. We work with the CCS program currently, and we work in facilities, homes, libraries, residential homes, wherever the youth we serve and their families feel most comfortable. And originally, our company was founded in Colorado as an education company, but we've operated in not only Colorado, but New York, Puerto Rico, and now Wisconsin. And we're especially versed in the field of education and future planning skills.
Thank you. Tammy Christensen.
Hi, I'm Tammy Christensen. I am a therapist located in Eau Claire, Wisconsin, and I currently provide psychotherapy to a client within the La Crosse Consortium.
Thank you. Tellurian.
Hi, I'm Stephanie Coleman. I work out of the Tellurian Care Center in La Crosse. I am the CIT program. I provide CCS services, ISDE, and wellness out in the community. I also provide services for Jackson County and Monroe County. And I currently do have a couple openings.
And I'm Tim Blumentritt. I work at our care center on the south side of La Crosse. We've been in the community for 15 years. really value our relationship with La Crosse County and our community partners. Some of you may know that we were in the process of developing a 23-hour crisis stabilization facility on Jackson Street. And due to, as a direct result of budget cuts, that program has been cut, which we really wanted to be a part of the solution to serving more people. But if anyone's interested in the facility itself, it's kind of all set up to go. We're exploring other needs in the community and looking at things. But if you're interested in the facility at all, or partnering in some way, feel free to reach out to me. I do appreciate that.
Thank you. The parenting place.
Hello, everybody. My name is Jody Wiedock. I'm the Executive Director at the Parenting Place, and other staff joining me on the call today are Marilyn Huckenpuller, Susan Fossen, and then Anthony Gutteridge, who is one of our new family peer support specialists. Our updates are we are now fully staffed and ready to take referrals. So welcome to Anthony. Thank you.
Thank you. TLC Guardianship Services. Trailways Counseling.
Hi, I'm Nancy Schmidt, one of the admins on the team here at Trailways. Angie is out this morning and asked me to sit in. We are part of the CCS program, and we offer the ISD wellness and recovery, psychotherapy, and psychoeducation programs, services. One of the new things there's two new things, I guess, that I would maybe mention, that we offer parent psychoeducation group. Right now, we're in our second one right now, but you can find the request for services on our website. The first one was a great success, and the parents wished it had been longer. So this session is actually running a little bit longer than the first did. I think some of those parents did decide to come back for the additional. And another service that we are offering is supervision services. So if there's someone that is looking for someone to provide some supervision, we are also doing that, and you can find the link on our website for that as well. Thank you.
Thank you. Clark.
Hello, I'm Shelby Neubauer, Director of Client Services at VARC. We provide CLTS services, CCS services, ISDE, employment skills for youth and adults in La Crosse County and beyond. And I have some other team members on here today that I will let introduce themselves. Thank you.
Hi, I am Chad. I am a cafe supervisor at the Good Bean at the Cooler Recovery Center here in La Crosse. I do recovery support employment services here.
Hi, I'm Micheline Swan, Program Manager for Client Services. We cover Monroe County, La Crosse County, certainly. So we have adult service program, we have kids program, child and youth. And as an update, we still have 2 or 3 seat or spot available in our summer session. So if you think there would be some kids interested, well, yeah, we have a great team, so we can still accept some referral. Thank you. And with us, we also have our coordinator for child and youth, Ava Winton. She just had sound she's about to be admitted. Sorry about that. She had some sound problem this morning. So we'll have a chance maybe to see her and introduce her to our member. Paul, can you see her?
Ava? Yeah, I just admitted Ava, so I don't.
Okay.
Should
So in the meantime, our summer program will go all the way to August 2nd because we're trying to match the school schedule, obviously. We can offer one-on-one service or group service and lots of activity.
Thank you. Ava, were you able to get in, Ava?
Yes, and I can hear you. All good.
Thank you.
Yes.
I think this is it for VARC.
Thank you. Wisconsin Family Ties. Youth Villages.
Hi, this is Lydia Nix with Youth Villages. I'm a contract specialist, and I work on the contracts for your county. I don't have any updates right now.
Thank you. YWCA. I also saw a few others that weren't on the list. We have Life in Harmony. And Crimson Hound.
Hi, I'm Carrie Hoare with Crimson Hound in La Crosse. I work with consumers and their dog and their homes on co-regulation skills, etc. I do have a newer certification in pet loss grief specialist, so I am working with individuals who are going through anticipatory grief or going through the quality of life and passing of their pet and after death services. And I work with individuals in La Crosse County.
Thank you. We also have Megan with Deer Path here with us.
Hi, everyone. Can you hear?
Yep, we can hear you.
Hi, I'm Megan Franklin. I'm the treatment director here at Deer Path Integrated Living. We have 2 residential living facilities and then also 2 live-bys in the Necedah-Mauston area. Currently, we don't have any new updates, but I'm really hopeful that we'll be able to share at the next meeting some exciting updates.
Thank you. Jordan with Grace Counseling and Family Services.
Yes. Hi, I'm Jordan. I'm a CCS coordinator with Grace Counseling. We've had some staff turnover and different things, so we haven't had a lot of services in this consortium in quite a while. So we are hoping to be able to fill some roles here soon for kind of ISDE and therapy services. Thank you.
Thank you. We have Bill Humphrey with Essential Skills.
Hi, thank you. Yeah, Bill Humphrey, Essential Skills Peer Support. I'm a solo entity, so it's just myself. My background is in outdoor education and wilderness therapy. I work with youth and young adults and adults in the 3-county RIC consortium. I utilize the green spaces and public parks in the 3 counties. Let's see. I have a new website. That's my update, and I'm outlining in my website the wellness management and recovery services curriculum and outcomes that I provide. Thanks.
Thank you. See that Amy with Life in Harmony is with us today, having some technical issues, but she did put some information in the chat. Thank you, Amy. Are we missing anybody else?
Yeah, I'm Lamont McFerrin, and I'm
Hello.
a
psychotherapist who works in mindfulness-based cognitive therapy. I'm a solo entity, and I think I specialize in helping people find more peace in their minds and finding more clarity and with emotional regulation skills. I do in-home therapy, and I do have an opening as well.
Thank you.
Yeah, you're welcome.
Hi, I'm Tammy Els. I'm the manager of Evergreen Manor in Necedah. We do have a few CCS residents from Monroe County.
Thank you. We also have Melissa with Children's Wisconsin here. She says she doesn't have any updates, but thank you for being here, Melissa.
I'm Jay with Integrated Mindfulness Institute, and I share mindfulness, Qigong, yoga, meditation, and breath skills with CCS consumers. I'm in the wellness management services and work in all 3 counties. Hello.
Christina with New Journey Wellness and Consulting.
Hi there. Yes, my name is Christina Bechtel. I have a LLC called New Journey Wellness and Consulting. I'm very new, not new to CCS. I actually used to be a CCS service facilitator, so very familiar with the program, but new to owning my own business. So I do some psychotherapy, not too much these days, but I am seeing some CCS folks. I do internal family systems, accelerated resolution therapy, DBT, CBT, so a lot of different ones, but I also provide mental health trainings to agencies. I do some staff retreats, self-care, leadership, strength-based. So I'm gonna put my website in the chat box. So if you wanna take a look at some of the services I offer, please do it. It's great to be here. Thank you for the invite.
Thank you. Anybody else want to jump in?
Hello, my name is Kaylee Kohlhauer with Driftless Aspiring Youth, and I work with the CCS program in La Crosse County.
Thank you. Anybody else?
I noticed in the chat, there's Melissa Cantwell from Children's Wisconsin.
Yep. Thank you, Cindy.
We also just wanted to add that for Stein Counseling, we have multiple NMT trained providers, as well as a level 3 trained provider who can do trainings through the state. Thank you.
Thank you. All right. Well, thank you all for being here today. It's a nice big group. With that, if there's nobody else, we can move into the rest of our agenda. A few contract updates. The first one, just a quick update. For those of you who do this, the civil rights compliance, anyone who received DHS, DCF funding, that has been extended for those of you who do not know, through December 31st of 2026. It was previously through the end of 2025. So Cindy, did we ever decide how we were going to notify them in terms of the provider?
We can do a letter out to the ones who all currently have a civil rights compliance letter of assurance with us. And we'll include the letter from the state that we received explaining the extension for a year. And also in that letter, it includes links to the websites for further civil rights information. So we will get that out to you before the end of the year here.
And they did mention in the letter that there will be some updated information and training at the end of 2026. So hopefully sometime before 2027, we can bring that new information as well. So just a little update on the civil rights compliance. And then it's already that time of year to start thinking about 2026. So many of you will be receiving a budget packet in the next month or two. So I just have a little information on this year's 2026 budget. I'll share my screen here. Can everyone see that? Is it showing up?
Yep, it's showing up.
Okay, great. All right, so planning to have budget packets sent out to vendors. Our target is to have those sent out August 25th through 27th. So be by the end of next month, and then have those due back by September 12th. Gives a few weeks to look those over. A lot of them are just a quick review and a signature, but they'll hopefully have those sent out by the end of next month. Due back on the 12th, and then we will be preparing the contracts throughout the fall to go into effect then on January 1st. So it's been a fast year. So some of the services will be getting the CPIU increase. We started doing that in 2010 with 3-year contracts. So in years 2 and 3, they would automatically qualify for a CPIU between 0 and 3%. So we have 2 different phases of budget packets, which I will show you examples of those in just a quick second here. The CPIU amount, we will be looking at that. It'll be determined usually around mid-August. We look at the July CPIU. It's currently been hovering right around 2.4, 2.5%. So I would expect it would probably be in that range, but we'll wait and see in August what the final numbers end up being. So as I mentioned before, there's 2 different phases of the budget packet, and phase 1 is the negotiation of the base rate. So that's in year 1. So if you get a budget packet without the CPIU on it, that would be phase 1. It'll have a spreadsheet where you can agree to continue with the prior year's rates, or you could fill out a budget request form. And we base it on the state's allowable cost policy manual. So our goal in the end is to have the option to renegotiate the rates every 3 years. So if you feel like your increases haven't been enough to cover your expenses in the past, phase 1 is a good time to look at that rate, fill out a budget packet, and then we can review that. So the phase 1 budget packet will look like this. You'll get this in an email. It will list your contract and services, your rates. We'll have our funding source on there, and then we'll have an estimated number of units. If you wish to continue, all you need to do is just sign the bottom of that budget packet and send that back to us, and we'll be good to process your contract. If for some reason you want to take a look at a new rate at that time, you can also fill out a budget request form. Here's just an example of what it looks like. Many of you have probably seen this before. It's got 4 tabs on it. It'll have a face sheet, a salary and fringe breakdown, an expense distribution form, and your profit calculation, and then we can review that to establish the rate going forward. So that's phase 1. But a lot of the services will be getting the CPIU, which that is phase 2 of our budget packet for years 2 and 3. So you'll be getting a very similar spreadsheet that will list the new rate with the CPIU increase factored into it. So if you do feel the need to renegotiate a rate before the 3 years is up and it's not part of a RFP, you can request a budget request form. But usually in years 2 and 3, if it's eligible for the CPI, you would be getting the phase 2 budget packet, which looks just like this, very similar to phase 1, except we will have the estimated units and the new rate that will factor in the CPIU increase. So, and again, that can be between 0 and 3%. Again, right now it's around that 2.5% mark, but it does have a cap of 3%. So just a few things to note. You could, if you have multiple contracts, you could receive both phase 1 and phase 2 budget packets. They do look similar, but if you do get both, we would need both of those back. There may be other documents with them, such as room and board cost sheets, if applicable. You will not be receiving a budget packet for services that have rates that are non-negotiable, such as when we will pay a retail price or rates that are set by the state, and that includes the CLTS W rates as well. CCS residential rates are also not part of this budget packet since those are set using actual costs. So we'll reach out to you later in the fall to get those rates from you, but you will not be receiving a budget packet for CCS residential. Also, if you have a multi-year contract at a fixed rate, you wouldn't get a budget packet because we should already be set up for the length of that contract. You also won't receive a budget packet for services that will be part of an RFP because the RFP will be setting those rates. And we do have a couple RFPs coming up, which we'll be talking about here in just a couple minutes. That includes psychotherapy, employer-related skills, and substance abuse for CCS services. With your unit estimates, we will be getting estimated units from our program staff and managers. So when you receive your budget packets, the unit estimates, it will indicate the units of service that are projected for this year, and that is an estimate that we arrive at by looking at what was purchased in the last year and if there's any program changes. So we will be using those estimates to figure out your total contract amount. So let us know if you feel that any of the unit estimates are not accurate. And then when you do receive your budget packet, you should review all the services and the unit estimates. And then all you have to do, if everything looks good to you, sign it, send it back, and then we will be able to process the contract and send that your way for signature. So we try to make it as easy as possible. So, but if you do ever have any questions at any time, you can always call or email me as well throughout the process. So, did anyone have any questions about the budget process coming up? Well, that's good. That's good. Let's not be too confusing. All right. Well, thank you. So that's the updates I had for the contract unit, and now just wanted to touch quickly on some RFPs that we have coming up. We don't have a release date yet, but I would imagine sometime in the next month or so, we will have a release date for RFPs that will be coming out for CCS psychotherapy and substance abuse treatment, as well as employee-related skills. And I didn't know if Heather or Ryan or anyone wanted to touch quick on either of those RFPs.
Yeah, I can. This is Heather Lind. I can talk really quickly about psychotherapy, substance abuse, and employment. So just highlighting some of the changes. The main changes that really relate to some of those policy changes that occurred last fall. So QTTs, so those who have an in-training license, and clinical interns cannot provide psychotherapy. The criteria for billing as a sole provider under psychotherapy, you have to be a sole provider or you have to be under a DQA 35 license. So this is also written into the RFP, but preference will be given to any agencies that provide services outside of CCS, so through an MA card, private MA card, or sorry, private insurance, or private pay, to promote continuity of care before and after CCS services. So in short, providers and agencies that don't accept Medicaid or private insurance may not be guaranteed, and referrals may be prioritized lower. And I think this year we put the psychotherapy and substance abuse together in one RFP, but just a side note, the substance use treatment, that covers outpatient substance use counseling services and substance use residential treatment services. Just a side note on that, substance use residential services can also be covered under your MA card. And it doesn't cover court-ordered assessment, urine or drug screens, detox, inpatient treatment, narcotic or opioid treatment. Outlines criteria, the RFP outlines criteria as a sole provider or under the DHS 75 clinical license. Dual diagnosis providers will need to put in for both psychotherapy and substance abuse treatment. And then finally, employment skills. Preference is given to evidence-based employment training programs, so IPS, which is individual placement services. The service rate does not cover sheltered workshops or clubhouses. So how does it look different from ISDE? ISDE is going to focus more on those daily living skills, so cooking, cleaning, basic emotional regulation, interpersonal skills, whereas employment is going to focus on the skills to find, obtain, and to keep a job. The skills learned in ISD are a little bit more general and should be able to transfer to home, work, or school, whereas employment is really targeted for that specific purpose. So those are the updates on the RFPs, just some highlights on those. Just as a side note, the substance abuse, we haven't done one for that before, so this is the first year we're doing the RFP for the substance use treatment. Any questions?
I think one
Again,
point
as
of clarity that I have,
yes.
Heather, was with psychotherapy. Last fall there, if somebody got confused, the way I heard it in my head was, so QTTs can do psychotherapy if they have a DSPS and training license. What changed last fall is clinical interns, the formerly QTT type 2, can no longer provide psychotherapy. So that'll just be spelled out more in this RFP. So
Thank you, Ryan.
Any other questions on those CCS RFPs? Well, just keep an eye out. Like I said, we don't have a release date yet, but I would imagine within the next month or so we'll have a date and get that out. So just keep an eye out for that. We'll get that out to you, and then we'll work through that and get those rates set this fall and be ready to go for January 1. All right. With that, we are right on time to move into the CCS vendor information.
So I can start with that just as a follow-up to the email that was sent out. So just training and supervision. Annual training logs and supervision logs, we're asking that those be turned in by September 1st. The reason being is that allows just for some more time to be reviewed and to add in any potential corrections or missing hours before the due date of January 30th, 2026. So vendors that are out of compliance beyond 1/30/26, that may result in a corrective action plan or a contract being considered out of compliance and not renewed for 2026. So reason again being is that DHS and DQA, they're really focusing on the quality of provider staff and the quality of clinical services that are being provided through CCS. So we as RIC need to ensure that staff are being trained properly and appropriately and that they're meeting those clinical supervision requirements. So once the year is completed, we can't go back. So we can't make up those hours. So that's why we're asking to have them put in ahead of time. Citations could occur for staff and programs that are out of compliance. We've developed, and we'll bring those to the coordination committee, a notice of finding form and a plan of action form. So once we have those reviewed, we'll send those out to everybody just so you know what those look like. training and credentials, those need to be relevant to providing mental health and substance use treatment services. So in the past, there's been some questions about what degree counts, what training counts. Big picture is thinking about how does this training topic really prepare or advance your staff or yourself to provide clinical treatment services for mental health and or substance use. Again, the why, DHS is honing in on the quality of provider staff and clinical services that are being provided. So we need to make sure that staff are being trained appropriately and meeting those clinical supervision requirements. An example that is provided is when you go to a hospital or a doctor's office, you trust that the staff are competent for the specific treatment tasks that they're assigned to do. And when you look at it, how it affects CCS is when you enter into a mental health or substance use treatment program, our consumers are trusting that the people that they're working with are confident or incompetent and able to provide the specific treatment tasks. So whether that be skills training, wellness coaching, etc. And that is it for updates on the training part. Any questions on that? Then I'll send it over to Ellen.
To go, yeah, absolutely. Thank you, Heather. Yeah, to kind of go off of that with our clinical supervision meetings that we've been providing with our mental health professionals who have had those times to connect with vendors, looking at that to make the best use of that time as well, since it has been an expectation that vendors get their individual own clinical supervisor to handle that within your own agency. We've looked at like how can we better support you in some of the areas that like Heather said, to make sure that, the staff have adequate, have some good training around the work that you do around the mental health work. So switching as of August 1st, officially this year, August 1st, 2025, the mental health practitioners will be moving to where they'll be doing some training on those meetings rather than that clinical consultation, rather than offering that. So with that in mind, we're asking you if you have ideas as vendors of like, where are some areas you'd like to have some better training in that maybe our mental health professionals could provide to you. If you have ideas, to send them to the CCS Soups mailbox, and we'll pass that on so that they can look at do a little research and then maybe provide some of that to you on those meetings that we have going forward. Something we've been doing internally, and it's been really, really helpful for our social workers directly by providing the direct, effect as it is in our program to that recovery piece of working with consumers. So questions. Carrie, looks like you have a question.
Yeah, going back to the training log, it's due on September 1st, and the boundary and ethics training is the big requirement, and I'm actually doing mine on September 12th. So can I turn in my log after I take that? Should I log it beforehand and turn in September 1st? What's the preference?
I guess I would say you could turn it in after, well, trying to think just for consistency across the board. My initial thought is I think I'd rather have you turn it in on the 1st so we have it. And then if you could just put a note on there that you'll be sending an updated one at the 12th. That way we don't have somebody reaching out to you asking for more information, and then you can submit it when it's done. So I think continue with the 1st as the deadline, and then add that additional information on there, and then submit once you have it done on the 12th.
Okay, perfect. Thank you.
Mm-hmm.
Additionally, I just want to add that too, that the MHPs will send out those topics ahead of time. So you have some time to plan to, like, is it an area, is it something that you want to attend, so you have choices and options of looking at that as the, as those meetings come up. They will kind of, like I said, have that out in advance so that you have an idea if that's an area that maybe you need have some interest in exploring, getting some more education around for the work that you do. If there are no additional questions on that area, I think I'll pass it off right now to Ryan in discussion around the billing and the financial end of things.
So, yeah, a lot of information today. So appreciate y'all trying to take it all in. And so where I'm going to shift us a little bit is more on the financial business side of things. So just to give some idea, this year, DHS said, hey, we don't need to do the fiscal audit anymore if you make over the $100,000, right? What has happened in its place is Medicaid is doing spot check audits at time of submission instead. So what is happening is CCS is still being viewed as a clinical treatment program, is still using Medicaid money. And so because of that, we're still getting audits. It may not be of your whole agency, but it is of specific services and specific plans. So already we've had a few in the last several months where you all submit your notes to us. We submit it to Medicaid. Medicaid says, put a stop payment on this. We need to see the medical documentation that proves this diagnosis. We need to see the assessment that justifies the service. We need to see the service plan that authorizes this. And we're checking your notes to see if we're going to pay out for the service that was being delivered. And if it's in alignment with the service plan that authorized the time, the assessment that justifies the need, and that it aligns with the official diagnosis in the medical record. So that has started in its place. So just wanting to name that for you all, that your notes are getting more scrutiny and still being expected to have a high level of clinical treatment service quality. So I know already there's been some reflection, not any findings where anybody hasn't gotten paid, but you know, if you're claiming a 4-hour service, your note should be a bit longer to justify what were you doing for that full 4 hours. If you are doing a shortened service, but it seems like, hey, we're just kind of out doing rapport building activities out in the community, some questions about what was the clinical intervention that was being provided. And how does that relate to the treatment of the diagnosis that's been identified in the medical record? So we're seeing this tightening happening and coming back. So we switched a full fiscal audit for a spot check audit of your individualized services. So just wanting to name that for you all. And again, I already saw in the chat, like a training topic that would be great is progress notes and documentation. So I know that one was already on the list for our mental health professionals as well, as like we should get back into this and do some progress note training and talking about what are interventions and how do we write for the interventions that we are doing. So kind of with that, another theme that has come up from those audits and from even just our QA team is the theme of how much time can we bill for documentation. The Medicaid industry standard is 1 unit for documenting your service time. So per service, it's 1 unit, which equates to about 8 minutes to 22 minutes rounded time. Anything beyond that is considered essentially that overhead cost of non-billable time that gets wrapped up into your total rate. The exception really for documentation is for diagnostic evaluations, where there is time spent by a professional writing up an assessment summary or a diagnostic evaluation summary. So those services tend to get longer documentation time because there is then a 10 to 20 page report documented that comes with that also. So just naming that out loud as well. I know we've gotten some questions over the years or, hey, but it took us 30 minutes. That rounds off to 2 units. Medicaid standard is 1 unit per note. So again, just kind of pausing for questions or just to process the information.
I have one. Somewhere I got a message that the 1 unit of note taking for every hour of service, and I don't know how that was somewhere. Is that still a thing? Does that still exist? Because
that is not the standard that I have heard.
Okay. Okay.
We can certainly double check and confirm that, but yeah.
Any other questions? Going off of that, also just looking at service plans and how they're authorized. Service plans, currently are set up as and developed as a 6-month service plan, unless, otherwise there's any other specific discussion or conversation. But that's how we're looking at when you're authorized to provide a service on working alongside of a consumer or family. There has been some, things going, it seems like going on some patterns of like, hey, like we just need to kind of like keep going, continuing this on as it is. However, like each plan is set up as an objective for that outcome to be met within that 6-month period of time. Now, obviously there is discussion and there's conversation as you're going, as you're meeting in those team meetings. But the idea is that the focus should be that the goal of the team is to meet that objective within that 6-month period of time. And we know that, like I said, there are instances where that might be, there's things coming up, but in general, that is the focus as we are a recovery-based program and have to continue to look at our programming as such, as we work alongside consumers. Just helping everyone to just be aware, as we are doing that internally as well, to be aware and be planful around providing that targeted service during that period of time. Of course, if things come up, that's a conversation. That's a team conversation. That's a conversation with your facilitator and your mental health provider around kind of what's going on. Is this the right service, right time? Are there things that we need to look at as we're doing that? But you'll see those conversations coming up more and being more targeted around working on that, really honing in on this is the consumer's targeted objective to try to work on completion of this in that time frame. Again, like I said, things come up at times that's not, we know that it's a work towards, but that's a continued conversation as you meet and have those team meetings around that. But just to keep that reflective and in mind when you're doing your work is that when you're on that plan to really hone in on what you're on the plan for to provide that service to the consumer and to work toward help supporting that consumer in that success of that objective on that current service plan. Any questions around that? Again, it's a work in progress and we're all working together in regards to trying to really, focus in on the premise of the program and to support the consumers, again, like in that basis of this being recovery and a goal to graduate our consumers from their programming as needed when those ready steps are there, and hoping to get everybody on the same page, working to that recovery-based outcome for our consumers. With all that being said, I'm going to pass this on to Ryan to talk about a different direction here a little bit in regards to our team, which is the Pathways team that is working alongside a group of consumers in a different reflective way.
Yeah. So Pathways is an initiative that's happening here in the city of La Crosse. So for those who aren't in the city, may not have heard of it, but it's where a lot of my time and focus has been of late. So, but Pathways is a collaborative effort of multiple community partners coming together to say, hey, how do we build a better system to support folks who are experiencing homelessness in the city of La Crosse? And it's a partnership of the city of La Crosse and La Crosse County, just coming in and helping bring some organization and structure to the existing agencies out there and existing resources that are out there to say, hey, how do we pull together and work together? So there's a multi-agency case conferencing that happens once a week. There's a couple different meetings throughout the week just kind of pulling all the various people together. Not necessarily us stepping in to do the work, but pulling folks together. We also have a work stream that's coordinating our local faith communities. As folks go from one church to the next church to the next church asking for help and support, how do we build a system of our faith community to have a one response system or a one place to go kind of response from that network of folks. We're also doing time coordinating with housing development projects that are happening and connecting with contractors of, hey, we heard you're doing a thing in town. Can we figure out how to get some low income units out of that, and helping to build more housing options in the area. So a lot of work is happening. There is a spot on our La Crosse County website with more information and data points if you're interested in that. I know some folks have heard that, CCS has a spot at this table. We are part of helping put together a specialized case management unit that I'm helping facilitate. So with that, we have some CCS workers who are doing CCS as normal, just with a specialty target population of those experiencing homelessness or at risk of homelessness soon. We're in process of launching a new housing support program. There was a new Medicaid benefit that came out in February this year that provides funding and reimbursement for case management for folks experiencing housing instability or homelessness. We're in process of developing a transitional housing program at our Hillview campus in La Crosse. So there's a lot moving. I know another thing that we're working on is hiring peer support specialists from within our unit. That housing support program is where those peer supports are going to spend a lot of their time and helping folks learn skills and capacities to navigate the housing search process and find housing if they don't want CCS or don't qualify for CCS. So it's a lot moving over here in the Pathways unit and trying to look at how do we partner and work through helping those experiencing homelessness. So yeah, knowing that CCS does have a foot in this as well, and you all are providing services. Again, if anybody has interest in I'd love to be part of that or allocate some more interest in that specialty group, feel free to reach out and let me know. And we'll connect.
Ryan, I did have a couple of questions. This is Tashira with Hope Restores. Did you say that you were spearheading the connecting of the faiths or the churches? Is that something that the county is trying to spearhead, or is that something that you guys are coming on board with?
Yeah, so I don't spearhead that myself, but one of my colleagues at La Crosse County does. We host the meeting, we facilitate the meeting, but it's just kind of an invitation for the faith community partners to come together. And they're kind of working out, what does this mean for us and how do we partner together? So yeah. So La Crosse County hosts the meeting, and we hold the space and the invite for it. So there's interest, it can get you connected. Mm-hmm.
Yeah, I would love to be connected with that. And then I would also be interested in being connected with the housing project as well. One of the biggest barriers that a lot of people run into when it comes to the idea of having everybody connected in one system sounds great, but I got to tell you, a lot of the clients that I work with, what they run into is questions like, who else are you working with? Or well, you've already got part of the help and only one of us, if you get help from one person, you can't get any help from anyone else. And so it kind of turns into an amplified tattletale system. I mean, I really, you know what I mean? It doesn't change. The need is still there to receive that help and support. Only the difference is now clients are being blocked out of, all of these receiving resources and help from other places And, you know, one of the problems with that is that if the resources that you're receiving from one place, you have to jump through a bunch of hoops for it. Now they're taking up your time even more so, you know, and you're coming up short. So now you need to do whatever programs or rules that are in place in order to get this funding. And then you're also still coming up short, and there's no way to reach out and get help from other churches or other resources because now your name is on this list of. It's just I've seen it happen, and I've seen it meant to be something that's supposed to be like really helpful, but it's almost been like turned into an even greater barrier as far as like you getting out of that point of urgency or like scarcity and getting that helping hand that you need. So I would be very interested in getting involved with some of those communications.
Yeah. So, Shai, are you part of the Wednesday case conferencing group?
No.
Because that would be I think what I'm hearing you say is kind of that would probably be the best spot, because that's where the agencies come together and say, hey, we have this person in our community. How do we coordinate all of our resources from all the various players involved? Who is working with this person? Who else is working with this person? Who else could be working with this person? How do we do this together? So yeah, let me get you in connection with some folks who lead up the different groups there.
Thank you.
Well, I think the last thing on our agenda is the big frequently asked question. Folks have been watching the federal budget discussions and Medicaid policy conversations, and now that policy has passed and is moving forward. So the question is, what does that mean for us? We've been asking state throughout the whole process, what does this mean? And the response really hasn't changed. It's we don't know yet. We're waiting for what the fine print and all the details say and what that means. And then Wisconsin DHS will evaluate what that means and what implications those would be and give further guidance once we have the actual, here's what needs to happen. So a lot of the messages from various state leaders has been kind of status quo for now. We're keeping our eye on it, and we'll keep everyone updated as things move forward. Okay. We got a lot of information today. That's kind of the end of the updates that we had for the group today. Open it up for any other questions or conversations that might be needed.
Looks like Carla, you hand up?
Yes, one quick question. This was a question back in January of last year to Chris Sanders, and it's just kind of a follow-up. Is there any update on the use of the opioid settlement funds by the county yet as to what is the purpose of those, where they are going?
Anyone have any more information on that?
I don't have an update. I don't know.
Okay.
All right. Well, thank you. Ask we can take back.
Okay, thank you.
Jai?
I'm wondering if somebody is getting the spot audit, would they know, or are you just doing what you need to do to make sure they have everything they need?
Mm-hmm. Yeah, for the spot audits, we take care of it between QA and one of the supervisors if we need to step in. A lot of it is the stuff, essentially it's just copies of the documentation. What Medicaid sees on their end is Jay from Integrated Mindfulness would like to be paid this amount of money. And we get a letter back saying, hey, we'd like to see what exactly did Jay do and how was it authorized, so that we submit your notes, and the service facilitator's assessment and plan is kind of like the, hey, here's what this service is and what it's about.
So would I get an update that says, can you do better on your notes, or
Yep. If we
Okay.
got something like that, yep, we would bring it back. Otherwise,
Okay.
for the most part, if everything goes through fine and clear, like, y'all won't know unless you really want to know. We're taking care of it. So
yeah, I personally would want to know so I could do better.
yeah.
I do believe, Jay, also sometimes even our MHPs are reviewing notes and things at times. So sometimes they may just reach out and say, hey, I know you're on the service, on this plan for this, and this is the, so they may just, sometimes I've known them to reach out at times to just talk through, like, if it seems like there's, any like questions, or if they have questions for you, they'll reach out and talk to you about it to talk through some things too. So that's something that we might do internally to prevent something from bigger happening down the road too. So
Yeah, awesome. That makes a lot of sense. Thank you.
Any other questions today?
I do have a couple updates just for CLTS, Paul, if that's okay. Maybe you had that next. Okay.
Go ahead.
So I just wanted to, for the biggest thing for CLTS for this year is that DHS took over contracting. Providers will go directly through the provider registry. Locally, we still have oversight over it, and we will still set vendors up. So I just wanted to let current vendors know that if you currently are doing a service and you want to add something else, the process would be to reach out to me, and you would just let me know that you've added that new service description to the provider registry, so we know that you're approved to do that service. And then I'll set up like a call with you to go over like what the rate would be if it's not a state rate. Tiffany and I would work together to get that set up. So basically, we are still making sure that providers are credentialed correctly, but the state has the full oversight over it now on approving providers. So if you do have anything new you want to add, just reach out to me. The other thing is, like, if you are a sole proprietor, anybody that's coming in to do something, you would still have to do a background check. And agencies do their own background checks, but we would help with a sole proprietor. Anybody that's a caregiver, we still have to do at the county waiver agency level. And just for those of you that are current providers, you have to re-register every 4 years, and you're supposed to be able to get an email from DHS that tells you when your renewal is coming up. Typically, we usually get something in the email too. And we're going to try to have an internal monitoring system to kind of track that, just in case somebody's getting close to that 4-year mark. But I just wanted to mention that. And then obviously the biggest other piece is Gainwell. And that transition. And in the chat, I will put the link for this has all the information for vendors to look and understand Gainwell. Though we know we have some internal glitches, but I just wanted to reach out to let you all know that we have had some luck. A lot of newer vendors have said that Gainwell has been responsive, and they've called them back to walk them through the process, especially for vendors who have not typically build them ever. They just only knew WP or haven't even started with WPS, I meant to say. And we know that we have had internal things happening on our end because we use the Avatar system. So IT has been working diligently to make sure our authorizations are getting sent as soon as possible. Tammy Thompson is our main person that deals with helping us figure out if auths have been sent to Forward Health or not yet, or Gainwell. And then the service facilitators or coordinators can also give details if they put the authorizations in. We're hoping that we'll have all the issues resolved as soon as possible. And we just really want to thank vendors for having patience while we're getting through this initial part of Gainwell. I know they're putting this as a priority so that those auths can be sent, but they have been sent once in May and in June. And the little fine tuning that IT should have figured out should be hopefully done by the end of the week. So just bear with us with CLTS billing. You can go back the full 365 days. Now that used to be only 90 days. So hopefully these glitches will work themselves out. Tammy's been putting lots of time and energy into this, but Christy supervises her. So Christy, if you have anything else you wanted to add, I know you attended a couple of the IT meetings.
Yeah, again, just thanks so much for your patience with all the authorization issues. IT's working really, really hard on it. So, just reach out, reach out to your service facilitator and or Tammy, if you have issues with a specific authorization, and also just give us the details about the authorization when you email. That's really helpful. But again, working hard on it. Thank you again for your patience.
I don't have, the only other update just for CLTS is for those that do daily living skills and counseling and therapeutic services, a reminder that the service coordinators need a 6-month progress report on the outcomes every 6 months. So I think those are my only updates. Ellen, did you have anything else for waiver either that we missed?
Not that I can think of off the top of my head. So no, thank you, Shelley.
Yep. Anybody have any questions?
Hi,
Okay.
this is Casey
Oh,
with
sure.
Soaring Skills, and I do have a question about the 6-month review. We hear lots of different things about what that should look like from different counties. What is it that, like, how would like La Crosse County like that to look?
We don't have a specific, we've given template examples. It's literally how you want to develop that and show that progress on what you're working on with the child. And it has to be, it's not like CCS, as documentation is less involved for CLTS. So it's 6-month progress report just on the outcome you're working on with that child and the progress they've made toward it. It's nothing the state has given us. It's just progress report. Like a lot of times vendors will just still do email updates to workers throughout that 6-month period, which is really nice, but it isn't required. We do require the 6-month report stating how that outcome is met. Again, it's just for daily living skills and counseling and therapeutic services.
Harry has a question.
Yeah, so that gave me 2 questions. One of them is, so that does or doesn't apply to health and wellness
It does not.
services?
It's not a formal, but it is nice to have, especially with health and wellness being sometimes it's a higher rate oftentimes, and you're doing a lot of those similar things that are even more intensive than skill building. It would be nice even just to give periodic updates to the service facilitator, service coordinator. So again, it's not required, just for
Okay,
daily.
and it just needs to go to the service facilitator, not to someone else in CLTS.
Yep, different than
Perfect.
CCS.
Thanks.
Yep, thank you.
Oh, I have a question. So it does not need to have a SMART goal with measurable, like a measurable goal with data, correct?
Progress and how it's still working to meet the outcome. And as they mentioned in CCS, it's a recovery-based program, where CLTS is often a long-term service program. Sometimes when they have the mental health target group, it is somebody that would have more recovery-based programming, but oftentimes if they're under the developmental disability, autism, or physical disability target group, it is a more long-term goal sometimes that you're working on. So no, we don't have those same requirements as CCS.
Thank you.
You bet. I don't have anything else unless there's any other questions. Thanks, everyone.
Any questions from anyone else? All right, well, our next all vendor meeting will be on November 11th at 10 a.m. So we'll be sending those agendas out a few weeks before that meeting. So if you want to put that on your calendar now, the next meeting will be November 11th. And make sure to keep an eye out for the RFPs that will be coming out here in a little while, and for the budget packets, which will be coming out here towards the end of summer. And thank you all for being here today. Appreciate it.
Thank you all. Have a good summer.
Thank you. Thank you.
Bye.
Thank you. Take care, everybody.